Welcome to Gips Media. Everybody knows about coronavirus now. You have been hearing it since 2 3 months about this novel coronavirus only. Now it is getting unusual to listen to anything related to novel coronavirus because it's everybody is familiar about everything and also the precautionary measures that you need to follow. But still, cases is day by day increasing. If you see the general statistics as of today, it's nearly 50 lakhs of people got infected with this deadly virus around the world, and nearly 3.50 lakhs of people has lost their life battling with this deadly virus. So I just want to tell you in brief that three important things you need to see to prevent this transmission of this virus, or also three important things which will keep you safe from getting this deadly infection. The first thing, whenever you're out of your house, try to maintain a social distancing. For example, whenever you go to a public place like airports, railway stations, or usage of public transports. Actually, I not prefer you to use the public transport if it is crowded. If less amount of people's, okay, you can use it. But if it is crowded inside the public transport, try to avoid using the public transport. But whenever you are exposed to any gatherings or any public place, try to maintain a social distancing of nearly 1.5 to 2 meters from the nearby persons. And especially if you see somebody sick with coughing or sneezing and look sick, stay away from that particular person and make sure that you will not even going to touch anywhere near to that person who has been exposed with. And the most important thing you need to keep in mind, this coronavirus will be considered under droplet transmission. So this droplet particles are found to be heavier particles as per the CDC studies, and this size will be more than 5 microns. So it cannot travel for a long distance of over 1.5 meter or 2 meter, other than the smaller particles which can travel further. But this droplet particles, as it is heavier, it can maximum travel up to 2 meters from the source patient whenever he is coughing or sneezing. And that's why the social distancing of 1.5-2 meters will keep you safe from getting infection from any of the one who is sick or which is a carrier of this novel coronavirus infection. So maintaining social distancing is one of the major factor in keeping you safe from this deadly viral infection, or this is one of the major factor in preventing the transmission of this deadly virus from one person to another person. The second thing I just want to discuss you about is use of mask. Either you can go for surgical mask, or if not available, you can use a cloth mask to protect yourself from this infection, especially when you're going outside your house or if you're exposed with any public places like gatherings or airports and railway stations where there is usage of public. Better to have a surgical mask which is covering your nose, mouth and chin. And cloth mask, why it is not preferred means the pores which is present on the cloth mask is found to be bigger, and which will have an effective circulation of air from outside. So this particle which is present on the atmosphere can be easily inhaled inside through the pores which is present on the clothes. But in turn, if you see with the surgical mask, it's a 3-layer. The outside there's a repeller layer, the inside there is a filtration layer, and the one who is touching your face is a comfort layer which will absorb the moisture coming from your mouth and nose. So the preferred mask for public use is surgical mask rather than having a cloth mask. But if not available, you can go because there is no other option. So always try to wear mask, and while wearing the mask, certain things you need to consider, that never touch the outside of the mask because it is highly contaminated. And if you accidentally touches it, make sure that you will do proper hand hygiene. And other thing is that never put your mask on your neck, and or never misuse it. Actually, once you wear with the mask, until you remove it, make sure that there won't be any contact with the mask other than with your hands, or just pulling it down, or when you're trying to eat, you just want to remove it out or take it off and discard it safely, and you can wear with another one. And make sure that once your mask is getting damped or it feels like the mask is wet, the efficiency will come down. So immediately change with a new mask. And maximum duration that you can wear a surgical mask is nearly 4 or 5 hours, and after that you need to change it, because as time passes on, the wetness with the moisture which is coming out from your mouth and nose, the mask will be getting damped, and which will in turn decrease the efficiency of its filtration. So you need to change it immediately. So make sure that once you're wearing the mask, wear it properly, cover your nose, mouth and chin, and don't touch the outside portion of the mask with your hand, and once touches, immediately hand hygiene. So wearing mask and social distancing, these are the first and second point. The third one, I just want to tell you about the use of hand sanitizers. Whenever you are exposed with the public place, touching high touch surfaces where hundreds of people is in coming contact, for example the lift in the malls, or the escalators side rails, or the handrails which is present on different malls or different public areas, all those things are considered to be high touch surfaces where you can get the infection, because the virus will be staying over that, and once you touches and accidentally touches your face or this organism will be transferred onto your body and you will be infected. So whenever you are in contact with high touch surfaces, make sure that you will do proper hand sanitizing before you will touch any other part of your body or any other places. And you can either go for hand washing with soap and water if no sanitizer is available, and make sure that whenever your hands are visibly soiled, only hand washing with soap and water is preferred, and if not visibly soiled, you can go for the alcohol based hand sanitizers. Many people ask me which is more effective. If I say in comparison with hand washing with soap and water and with alcohol based hand rubbing, the duration is less in case of hand sanitizers usage. 20 to 30 seconds is the preferred time to give you 99.9% effective protection, whereas with soap and water you can achieve 90% of protection with 40 to 60 seconds of hand washing time. So if you see the efficiency, hand rubbing is more efficient because it's take less time and 99.9% of maximized protection. But for hand washing with soap and water, 40 to 60 seconds, but only 90% of protection can be ensured. But in certain cases, like whenever you are caring for a patient with Clostridium difficile, it's a organism which causes severe diarrhea, because this is considered to be as a spore forming organism. Alcohol will not destroy the spores. This should be washed out by using soap and water. So in case of spore forming organisms contact like Clostridium difficile, hand washing is more preferred. And whenever the hands are visibly soiled with any bloods or body fluids or any dirt, hand washing is again preferred over hand rubbing. But in normal all other instances, you can use it with hand rubbing with alcohol based hand sanitizers. And make sure that you will follow the right duration, 20 to 30 seconds for alcohol based hand sanitizers, 40 to 60 seconds for the hand washing with soap and water. And there are 7 steps actually for hand hygiene, and it's same for both hand rubbing as well as with the hand washing. The first one, you should clean the palms together, palm to palm. Second one is the back of hands with the dorsal cleaning, and you should interlace and make sure you will clean your web. The third step will be palm to palm with the fingers interlaced. You will clean in between of the fingers by the third step. The fourth one, you will clean the back side of your fingers, the dorsal part of your fingers, the groove of your fingers, as well as the tip, so that you need to interlock it properly. The fifth one will be the rotational rubbing of the thumb, and along with the thumb you need to focus on your web of the thumb. And the sixth one, you will focus on your nail tips, and you will do it clockwise and anti-clockwise on your palms. And the seventh one will be the rest. So if you follow all these 3 things, make sure that you can prevent the transmission from this organism to other people, or you yourself can keep you safe and from this deadly coronavirus infection. And I just prefer everyone to follow these precautionary measures, especially when you're going outside your house, and stay safe, stay healthy, and be positive. Thank you.